Hey, good morning, everyone. This is Hannah Deach from the Department of Education. We still have folks joining the call, so we're going to wait just another minute or two for additional people to be able to join us, but we'll be getting started soon. Thanks for being here. Okay, it looks like we've leveled off here in terms of participants, so I'm going to go ahead and get us started. Again, this is Hannah Deach from the Department of Education. I'm joined by a few other colleagues from the department, and also very grateful to be joined by Dr. Frank Welsh from Louisiana's Department of Health. Dr. Welsh has been a close partner to the department in developing the guidelines that we're going to discuss today for summer schools and camps and extracurricular activities. And those of you who serve early childhood centers may know Dr. Welsh as well, as Dr. Welsh has advised very closely on childcare guidelines for the same purpose. So very grateful for Dr. Welsh to be joining us today. Just a couple of things, if we could advance to the next slide, just a couple of things to go through in terms of logistics for today's meeting. As you can see, this is a very large meeting. We can typically have a more stable connection if folks take themselves off of video. So if you're on video right now, I'm glad to see your faces, but we have a more stable connection if folks take themselves off of video. You can do that by just selecting at the bottom left of your Zoom screen, stop video, and that will take you off video. I also would ask that folks stay on mute throughout this session. In fact, our Zoom is set up to keep the group on mute unless you are a presenter. You can raise your hand in the online system or type *9 on your phone in order to unmute, and then a moderator will unmute your line. But we have around 300 people on the line, so typically it's easiest for you to raise your hand if you want to speak. Lastly, here is how I'd like to spend our time this morning. I'd like to spend roughly the first 20 to 30 minutes really just walking through the summer, the guidelines for summer operations at camps and summer schools. So would like to really just give an overview and walk those through. As I'm walking through, if questions occur to you, I'd ask that you type them in the chat box. What we'll then do is aggregate the questions that we get in the chat box throughout the overview presentation and prepare those so that Dr. Welsh can answer those after the 30-minute overview is up. You may have additional questions as Dr. Welsh is answering the questions that have come in the first 30 minutes. But if we can kind of get those questions in the queue, we can probably move through those more efficiently once the overview portion is over. So first 30 minutes of overview, put your questions in the chat box. We'll then turn to Dr. Welsh to answer questions, and then there will be time to answer questions as they come up after that as well. But get as many as you can in the chat box as possible if that works for you. Okay, so moderator, let's move forward to the next slide, please. Great. And we can actually move forward to the next slide. And the next one. Perfect, thank you. So just to provide a little bit of context for the guidelines that we're discussing today, as you might know, the state of Louisiana has been developing a phased plan, the roadmap to restarting Louisiana for reopening various sectors of the economy. Okay, okay, thank you. I'm getting a note that the meeting might be capped and we're trying to open it for others in case you're hearing from others trying to get on. So actually, yeah, okay, I'm actually going to keep going. So State of Louisiana is developing a phase plan, the roadmap to restarting Louisiana, which basically is a plan for reopening various sectors of the economy once certain public health measures, metrics, or conditions are met. The plan is organized around phases of reopening that roughly follow federal guidelines. Currently, we are still operating under a stay-at-home order, although that expires today, that is my understanding, and we will begin the shift to phase 1 tomorrow. The transitions to and from these phases of reopening are determined by the governor, and phase 2 of reopening will be announced by the governor at a later time, but we are now entering phase 1 of reopening. So in light of moving into that phase, the Department of Education worked very closely with Louisiana's Department of Health in order to develop guidelines for operating summer schools and summer camps and extracurricular activities over the summer. So the Department of Health really guided us to develop the guidelines that we'll talk through today and the supplemental guidance that school systems can use if they choose to operate summer schools or summer camps. That guidance also was favorably received by the Resilient Louisiana Commission, which is the commission that the governor has established to review all guidelines for operating in phases 1, 2, and 3 of reopening. So not only have we worked closely with our colleagues in the Department of Health to develop the guidelines we're discussing today, but the guidelines were also reviewed by the Governor's Resilient Louisiana Commission, which is reviewing guidelines for all sectors. I wanted to just give you a sense of the path that the guidelines have taken so that you understand who has helped to develop them and who has reviewed them. Guidelines, by the way, for operating in the 2020-2021 academic year will be going through the same process, working closely with our public health colleagues, and then also moving through the Resilient Louisiana Commission that I just mentioned now. Many folks have asked, when will guidelines for the 2020-21 academic year be available? You can expect those to be available in the second half of June. We're working closely again with our colleagues in the Department of Health to develop those guidelines. We also have a team of school system leaders here in Louisiana who will advise us on those guidelines, and you can expect those in the latter part of June. Okay, thanks, moderator. If we can move into the next session, I'd like to just begin talking about the guidelines themselves. Yep, thank you. So there are 2 documents that I'm going to walk through today. The first is a set of high-level guidelines that the Office of Public Health has issued and that are linked here. These guidelines outline the required actions that must be taken to keep children and staff safe and healthy in any kind of summer school or summer camp or extracurricular context. The protective measures that are outlined in these guidelines basically fall across 3 categories. First, how to achieve appropriate social distancing in a summer camp or summer school context. We'll talk about that in depth. Next, requirements around monitoring students and staff for symptoms of the coronavirus, including fever, cough, shortness of breath. And lastly, appropriate environmental cleaning and hygiene actions that need to be taken in order to keep the summer camp or summer school environment safe and healthy. The social distancing, I think, let's move on to the next slide. I think that's detailed. Yep. The social distancing strategy in a summer school or summer camp setting is different than what is prescribed in, say, a retail establishment. So I think most of us in our day-to-day lives have become accustomed to the guidelines for a retail establishment, or even, say, in our parks and other community settings, which is to maintain 6 feet of distance between yourself and the next person. So to create physical distance between one person and another. All of us serve children, and so we understand that this would be very difficult to achieve in a school or camp setting. However, we still need to take precautions to limit the spread of the coronavirus. And what the Department of Health has recommended in a summer school or summer camp setting is a social distancing strategy that is based on static groupings. What I mean by that are limited numbers of individuals who interact more or less only in that group for the duration, for the maximum duration possible. When I say maximum duration possible, I mean for however long that camp is occurring and those individuals are at the camp or summer school, the best thing to do and what is prescribed here is to keep those static groups intact. So in phase 1, the static group is 10, and that includes adults who work with those children or students. In phase 2, that would be 25. In phase 3, that would be 50. So in phase 1, which begins tomorrow, you would have a static group of 10. That could be 8 students and 2 teachers. That could be 9 campers and 1 counselor. But that group would stay together for the maximum extent possible throughout the duration of the camp and in a day. That static group would travel together. If they're indoors in a physical space, they need to stay in the same physical space. And if that group uses shared physical space, the shared physical space needs to be cleaned before and after that group's use of the space. We'll get a little bit more into that, but here are the static group sizes. In terms of symptom monitoring, the Department of Health's guidance here is to assess symptoms on arrival and throughout the day, and this includes an initial temperature check. We can go on to the next slide. Here we have a bit more information about how those static groups can use physical space. So when those groups are indoors, they need to be indoors in rooms that are enclosed by walls or separated by partitions. One group within each individual physical space enclosed by walls or a partition. Again, if those groups are convening in shared indoor spaces like a cafeteria or an art room, that space would need to be thoroughly cleaned before and after the group's use. Again, this is to limit contagion by limiting the number of people who are interacting together or sharing the same spaces. Outside, groups should remain separated, but they don't require a physical barrier. So you could envision on a soccer field or any large grassy area, you could have different groups outdoors at the same time, not separated by a physical barrier, but staying within their group in a defined area and not touching or interacting with other groups who are in the same outdoor space. In terms of sports, in phase 1 and phase 2, the directive from public health is to refrain from contact sports. In phase 3, contact sports would be allowable within defined groups. Of course, summer is time for swimming, and the guidance here is that individuals can enter pools in a summer camp or summer school setting, but they would need to be separated in those pools by lane lines or ropes. We'll get into this to a greater extent, but as it relates to entry and exit from any summer school or summer camp facility, groups or individuals need to pass singly through entry and exit points. And this is to limit, again, individuals' interactions with one another to the maximum extent possible, to keep those static groups from interacting with other static groups. Of course, you can also have summer school students or campers entering individually, and that limits the interaction as well. Okay, we can move on to the next slide. So here we have some guidance around cleaning and personal hygiene. Again, shared indoor spaces need to be, one moment, please. Shared indoor spaces need to be cleaned after every group's use. So again, if we have groups who are using shared spaces like an art room or like a gym, they would need to be shared after every group's use. High touch surfaces, this might be doorknobs, this could be bathroom fixtures and so on, need to be cleaned every hour. This includes bathrooms. And hand washing needs to be frequent, and you can see some specific directions here. At arrival, at least every 2 hours, before and after eating, before and after using outdoor play equipment, and so on. And then finally, adults and children, as they are able, should wear cloth masks. Children under 2 should not wear cloth masks, and individuals with severe breathing difficulty should not wear masks, but adults should be in masks and children as able. Okay, let's move on to the next, please. Okay, so I just walked through the guidance from the Department of Health around summer programming, the guidelines. Those are hard and fast guidelines that must be followed, absolutely. The department has also created supportive guidance that is designed to support schools and school systems as they are implementing the guidelines that public health has established and has published. I'm going to pause for just 1 second in case folks want to pull this up, use the link to pull this guidance up. Okay, if we can move to the next slide, that's great. The guidance is more or less organized around a checklist, and then with specific guidance within that checklist. And again, many have asked what is required and what is helpful. What's required, absolutely, is what is included in the Department of Public Health's memo. What you see in the supportive guidance that is issued by the department are essentially best practices and procedures that a school or school system might use in order to effectively implement the guidelines. So I just want to make that very clear. That's stated at the beginning of the supportive guidance document, but I want to just make it very clear that what you see in the supportive guidance document is non-binding unless it is previously repeated in the Office of Public Health memo. Again, the guidance is organized around a checklist, and I'm going to just walk through these items in the checklist with you very, very quickly before we get into Q&A session. Okay, we can go to the next slide. Great. Next slide. Okay. So here we repeat the social distancing measures. Details on group size are included in the supportive guidance document. There's some more detail that we'll go through here. We also provide some tips on how to manage parent drop-off and pickup to limit contact and to ensure that kids are coming in singly or in their static groups, we have some guidance here on how how potentially to use curbside drop off and pickup, and also setting up hand hygiene stations at the entrance so that kids can clean their hands as they're coming in. We can go on to the next slide. We also include some guidance on how to clean sporting equipment after each group's use, and how to ensure that kids are appropriately using outdoor facilities. Next. We go into some detail also around symptom monitoring in the supportive guidance. The guidance that we have gotten from our colleagues in the Department of Health is that individuals who have a temperature of 100.4 or higher do need to be sent home. And if they have other signs of illness, they must not be admitted to the facility. Dr. Welsh on this call will be able to talk a little bit more about the 100.4 designation. This is questions about this have come up. So I will make sure that we address that in the Q&A session. But we also include a set of questions that that leadership might ask students and or their parents as they're entering the facility to make sure that they are healthy and well and able to safely attend. That's addressed under number 4 and also number 5, how to screen children. Okay, go to the next slide. We also include some best practices around how to implement isolation measures if a student does become sick, and how to clean and disinfect any area that student has entered. So there are detailed steps outlined here around establishing an isolation space, cleaning and disinfecting. We also include information about vulnerable individuals, who falls into that category, and how to appropriately speak to parents of children with health conditions to ensure that their participation is safe and approved. We can move on. Okay, we also go into some detail around personal hygiene and how to ensure that students in the camp setting and adults are washing their hands or sanitizing their hands appropriately throughout the day. So there's some additional guidance here around how that might work, when to use hand sanitizer versus when it's important to actually wash hands with soap and water. This is mostly gathered from the CDC. And so we pulled it from CDC guidance and included it here because it has helpful guidelines around when to wash versus when hand sanitizer could be used, and also how to ensure that this is happening on a frequent basis. Okay. And then also the CDC has really helpful guidance around cleaning and disinfecting spaces. That is included in the supplemental guidance as well. Again, not required per se, but the CDC guidelines around sanitation are very detailed and very helpful and are included in this document. Next. There are specific guidance and best practices around food preparation and meal service if your summer site is serving food to students. Again, these are pulled from the CDC's guidelines, very detailed best practices for your food services staff and others who are preparing and serving meals. Finally, we include some information on transportation. This is preliminary guidance that is pulled from the CDC's guidance around transportation. If you were on the webinar for school system leaders yesterday, you would know that we are developing supplemental guidance around transportation and also athletics. We know that transportation is a big question for many school system leaders right now, thinking about summer operations, and we need to provide Louisiana-specific, very detailed guidance around what's expected, particularly in terms of achieving appropriate social distancing on school buses, what that looks like, and also sanitation and symptom monitoring. We know that this is an area that many folks have questions about. We will be able to produce Louisiana-specific guidance in this area in the next 2 weeks. Please stay tuned on the Thursday morning school system leader calls, and we will be able to provide that guidance to you. But in the interim, we have included CDC's guidance, which is here as a best practice. More to follow on that, though. That's just a high-level run-through of the supplemental guidance. Obviously, there is much more detail in the document itself, but I want to spend the rest of our time asking questions of Dr. Welsh and allowing you to hear directly from Dr. Welsh. I'm going to pause now. We've gotten several questions into the chat feature. I thank you for that. Our team is going to pause, aggregate those, and then we will run through them. So give us 3 to 4 minutes to aggregate those, and then we'll be back on with Dr. Welsh to answer them systematically. Okay, Dr. Welsh, are you on? And I want to test your audio. We're going to go ahead and get started.
Am I unmuted?
Yes, we can hear you. Thank you so much.
There we go. I'm on.
Okay, great. Would you like to offer anything before we dive into questions and answers? I want to make sure you have a chance to offer opening remarks if helpful.
Absolutely. I'd really like, and again, thank you to everyone for being on. Thank you for being patient and understanding about what a difficult public health crisis that we're in. And also just, you know, I sort of say this all the time when I'm speaking to people, Louisiana, given how bad it was at the beginning, really is doing very well at controlling this outbreak. And that's what's making me feel a little more comfortable moving into this phase 1. There are a lot of places around the country who are not in our position. And I think that's because most people in Louisiana really have taken this pandemic very seriously. There are a couple of really common questions that I get that I'd like to review with all of you. And the first one is about mask use. And I think part of that comes from the fact that the original statements when the pandemic first began was that a mask was not useful and that we shouldn't use masks and masks should be saved for healthcare providers. And then about a month ago, everything switched and everyone needs to be wearing a mask. And I just want to walk through that rationale with you. Originally, when the pandemic began, not only were masks in very short supply and really needed to be prioritized for healthcare workers, it really was thought, and it is true, masks really don't help all that much in preventing someone who doesn't have coronavirus from getting it. And there are several reasons for that. We all know we tend to touch the mask a little bit if you mess with it a little bit, if your mask isn't properly fitted. Things like that means that the mask isn't necessarily going to prevent the virus from getting to you. In addition to that, we didn't want people to think that wearing a mask somehow prevented you from doing those things that we do know work, which is washing your hands, frequent environmental cleaning, staying away from sick people, staying 6 feet away from people. Those are the things we know are going to prevent you from getting coronavirus. Well, then about a month ago, not quickly, over the course of several months, we learned that there are a significant number of people who are out in our community who have asymptomatic or very mild symptoms of coronavirus. And this was unknown before. And wearing a mask actually prevents those people. For example, me, if I got coronavirus and still went to work and I wasn't that sick or maybe had the sniffles or no symptoms at all, wearing a mask actually is very effective in preventing me from transmitting it to other people. So that's the first one. Just there's a logical reason why there was no mask and now there's masks now. Again, masks prevent you from spreading coronavirus to other people, and that's why we're now recommending them. The second thing I get asked a lot is about the temperature checks, and there was some variability in what we considered a temperature before. Temperatures in adults, especially who get coronavirus, are really variable. In fact, a lot of people just get a low-grade temperature, and very few get very, very high temperatures. But what we do know is that children who do get coronavirus and are symptomatic do tend to have a temperature. And that's why there was some variability in that temperature check. Many people may have seen above 99 or above 99.5 or above 100. We feel very comfortable that if you do have a child who does have a temperature on arrival or during the day of greater than 100.4, that they should be sent home. It could be several things, but obviously that is a signal that a child is ill and needs to go home. So those were kind of the general things I wanted to go over, but I'm more than willing to address any other questions you all may have.
Thank you, Dr. Welch. That was very helpful. Just to start off and following on that comment about the temperature readings, we have a question about individuals who may have chronic conditions, such as familial Mediterranean fever, who periodically have elevated body temperatures not related to COVID-19. How would you address those populations?
I would probably say that if they did have a temperature, I would not want them to come to camp or an activity. And the reason is because we don't know, unless I knew that it was their genetic or their disease, I don't know that it's not coronavirus. And so I think just to be on the safest side, it would be to have that person stay home, treat their condition. Certainly if it, be in contact with their primary healthcare provider, in consultation with them to see if they needed a coronavirus or felt that a coronavirus test was appropriate. And then once they were AFEB, I'll come back to activities.
Very helpful. Thank you. We've read a lot in the news. I know it's been in several newspapers recently about, it seems like a rare, but we're hearing about it, reports of inflammatory reactions in young children. I'm wondering if you could just talk a little bit about what we know about this disease in young people, how concerned we should be about the recent news about the inflammatory reaction that some have had, and if you could provide a little context on that, Dr. Welch.
Absolutely. So at the beginning of this, especially when this was a disease restricted to China and then Europe, the mortality rate, the death rate among children was very, very low. And it was initially thought that maybe children don't even get this, or even if they do get it, it's really, really mild, and they really don't suffer many consequences of it. And the mortality data continues to be the same. Children in the United States tend not to die of coronavirus nearly as much as adults do. Unfortunately, what we are learning more and more as we are going forward, that children, even children who have asymptomatic disease, absolutely have no symptoms at all, are subject to several conditions. And the one that was mentioned, an inflammatory-like condition, is unfortunately not as uncommon as we originally thought it was. We do have multiple cases in Louisiana. There are cases all across the United States and around the world. So in young adults, what they're finding is they're seeing an increased risk of stroke in people who have recovered from or had coronavirus and never even knew they did. Now, again, that's fairly rare, but strokes are very rare in young people. And now we're finding in very young children, there is an inflammatory condition similar to what people might have heard Kawasaki disease. And what this is several weeks to a month after being exposed to coronavirus, whether they knew it or not, a young child gets an inflammatory illness of their arteries. And it can be an incredibly serious disease where children are hospitalized in intensive care, needing lots of intensive support to help them recover from this, and there have been deaths from it. So our original assumption that children are somehow either immune to coronavirus or immune to serious complications, even though they're not dying at as high a rate as adults are, was unfortunately not true. And we are seeing that again, children who are infected with coronavirus, whether they knew it or not, can suffer from some pretty serious consequences. And that's, again, one of this reasons for this grouping and group limiting is if you did have a child or an adult in one of these groups with coronavirus, we would want to do our best to limit the amount of people that person came into contact with. So that's the rationale for group sizing as we move forward.
Thank you. And I think, Dr. Welsh, some people might hear that information and say, well, should we not just keep schools and childcare centers closed indefinitely? Can you add a little bit of context around the groupings and how that helps? Yeah.
Absolutely. So there has, as anyone who watches the news knows that there's a controversy between opening, not opening, and as we all know, we can't live in a plastic bubble. So the governor of Louisiana did decide, even at the very beginning of this pandemic, there are people who do have to go to work. There are healthcare providers, there are emergency responders, there are people who work at the grocery store and the bank, and these people will have children and will need assistance with childcare. And that's why he left childcare centers with some pretty serious restrictions open during the phase zero, if you will, of the pandemic. And that doesn't mean, though, that you just open them up with no restrictions. And so that's why we put those restrictions on environmental cleaning, about limiting group size, about washing hands, about frequently touched surfaces. It's kind of the balance between if we are going to have these open, and now as we move into phase one, if we are going to have these summer camps open, can we do it in a way that there might be transmission, but if there was transmission, we want to limit the number of people who come into contact with these people. Many people remember at the very beginning, there was a gentleman from New York, out in the outskirts of New York City, who traveled to his office in New York City over the course of 2 days with relatively mild symptoms. And then he was later tested, and they found that this one person in the course of those 2 days had infected more than 150 people. So, just with limiting the group size, we really do want to limit the number of people who could possibly be exposed, and then also do these other things like social distancing, environmental cleaning, hand washing, to further limit the spread, to better protect children while still allowing for these things to take place.
Thank you so much. I have one more question that's more global in nature before we get into some very technical, detailed questions. But you and your team have been very helpful in explaining to our team how the coronavirus is transmitted through droplets and so on. I'm wondering if you could provide a little bit of that background, because it will be helpful in answering some specific questions that we're going to be getting around marching band, athletics, and so on. Would you mind sharing a little bit about that?
Sure, absolutely. So coronavirus as a virus is a little bit on the heavy side. And what I mean by that is that it would be very uncommon for the coronavirus to float around on the air and just be in the air in general. What happens is the coronavirus exits somebody's mouth or nose, and then fairly quickly, it's a little droplet of water, will fall to the ground. It will not float around very much. So that's why we have that rule for 6 feet. I kind of call coronavirus the lunchtime transmitter. You really do have to be sitting next to someone at lunch, speaking directly to them for more than about 10 minutes to get coronavirus. So in that respect, coronavirus isn't that easy to get, meaning it's not just floating around in the air. And that's why with these little bit heavier, wet virus particles, that's why wearing a mask prevents you from spreading it to other people. That's why, having sick people stay home when they're not coughing or sneezing, but also other activities you can imagine, like yelling or singing or things like that, where you are expending your breath. That we saw those examples of a church choir. There was a choir practice and more than 20 people were infected. They weren't doing anything strenuous, but they were all singing. And you can imagine that would be a really effective way to get these tiny little water droplets out. And then unfortunately, these water droplets can stay alive on surfaces if untreated by themselves, because it's a little droplet of water. And that, fortunately, with environmental cleaning, with a cleaning solution, it can kill those viruses within minutes, if not sooner. So again, the protective measures and the things that we're suggesting are targeted specifically to this coronavirus to make sure that it can't spread as well. And eliminating those conditions by which it spreads easier.
Thank you so much. That was very helpful. Ken, I'm going to turn it to you. My colleague Ken Bradford is on as well to run through some of the very specific questions that we've been getting from the group, and I thank the group for sending those into the chat. Ken, I'll turn it to you.
Yes, thank you, Hannah. Thank you, Dr. Welch. We're receiving several very, very detailed and technical questions, Dr. Welch. So I have taken those and I've grouped like questions. And so the first one that we're getting a lot that are coming into our chat is and maybe for those that haven't had a chance to fully read all the documentation, but could you just reiterate currently what the guidance is around if an individual becomes infected with COVID-19, what the quarantine is for him or her, and what the precautions are for the individuals, students or adults that may have been around that person who was recently diagnosed?
Got it. Okay, so I'm going to do this by scenario play. So say, for example, I was the adult at a camp and I was responsible for 9 other children, for 9 children, and we did some camp activities. If over the weekend I got a fever and I said, well, I think I have coronavirus, and I went over the weekend and got a test, and say that test came back positive by Monday, there is now almost in place a very large, what we call case identification and contact tracing process that's going to happen in Louisiana. So what will happen next, once I get that positive test, is the Office of Public Health will get my name. And what they'll do is they'll speak to me and they'll say, so Frank, you tell me what you have been doing all the way back to 48 hours before you develop symptoms of coronavirus. And based on the activities that I did, say I stayed home most of the time, but I did go to the grocery store once, but I wore a mask. And while I was at camp, I wore let's say I didn't wear a mask while I was at camp. Now, of course, I don't want anyone to do that, but this is a scenario I'm going to give to you all. So say I was at camp and one of the activities we did was art class, and I was within 6 feet of these other 9 children, or say 5 of the children during this time. And then when I came home, my family members were exposed, and say I had, because they live with me and we didn't wear masks inside the house. What would happen next is the Office of Public Health would collect the names of all the people that I had close contact with. And again, close contact is being with someone more than 10 minutes within 6 feet without any protective gear on. So they would then take the names and contact of all of these people, and it would include these campers. And what they would do is they would contact those people and ask them to stay home for 14 days and monitor for symptoms. So, and if they did get any symptoms, they would want that person to go get a test or test their doctor. There isn't currently any plan to test asymptomatic people, but we may get there. So this is the process that we're all talking about: case identification and contact tracing. So you may have some situations where at these activities, the administrator of the activity may be contacted, or several people may be contacted based on the fact that they are a contact of a case, and those people would be asked to stay home for 14 days and monitor for symptoms.
Thank you. We get several questions are relative to the current guidance for those with chronic conditions, for not only students that may have asthma or wheezing, and the considerations for them that go to camps, but also for adults that may have high blood pressure, diabetes, etc. What is the guidance currently for them relative to participating in like summer schools and summer camps?
Yeah, the guidance currently in phase 1 is not to participate. If you have a student with a high-risk condition, an immune suppressive condition, if you have adults who are over 65, have other chronic health conditions like high blood pressure, diabetes, we do know that people who have these high-risk conditions, when they get coronavirus, have significantly higher chance of having complications, whether that be a doctor visit, whether it be a hospital admission, needing to go into intensive care, needing to be on a ventilator. So those people, especially during phase 1 with high-risk conditions, are encouraged not to continue the stay-at-home order.
Thank you. Is there a difference between a medical mask and a cloth mask?
So there is, actually, and let me tell you the difference between that. A medical mask is better at protecting the person who's wearing it from getting coronavirus. Remember, I talked about at the start, the cloth mask, however, is better at, if I have coronavirus, preventing me from spreading it to other people. The problem with those N95 and high-grade masks is there just isn't enough of them around. And but in addition to that, I want people to remember that a mask should never be a substitute for proper social distancing, hand washing, things like that. Those things are much better, even than with a surgical mask at preventing coronavirus.
Thank you. The 100.4 temperature that is referenced in the guidance, is that applicable to the adults and students, 100.4?
So again, I would use that criteria for students. I would use it for adults as well, yes. The problem with coronavirus, I wish it was more clear cut. As I mentioned, coronavirus can cause, obviously, very, very severe disease all the way up through death, all the way down to there are people walking around who had it who have absolutely no idea they have it. So unfortunately, temperature is not a really reliable gauge of whether someone has coronavirus or not, but what it is a good gauge of is whether someone is sick or not. The flu will oftentimes give people a fever. Many other illnesses, disease will give people a fever. So think of that fever criteria as not, is it coronavirus or not? Think of it as, we're just trying to make sure that people who are ill don't come to camp, and it might be coronavirus. So I would use that 100.4.
Thank you. And next question is relative to the static groups of 10 in phase 1. And there's a couple of different scenarios that have come into the chat question. One would be when athletics are permissive by our high school athletic association, is it theoretically possible for schools to have, let's say, 5 or 6 different groups of static 10, 5 groups of 10 static groups, for instance, spread out on a football field complex? And then up in a school building right now, is it also possible that you have multiple groups of 10, but they're static in a classroom or a gymnasium, etc.?
So I'll answer the first one first, and the answer is yes. You can have static groups of 10 on an outdoor play field, things like that, currently during phase 1, just as long as you keep them separate. We don't, we got proposed the scenario can kids swap out of groups and into other groups? And the answer is no. You really do want to keep the group of 10 together, just as long as you keep them separate in that outdoor area. With the indoor groups, currently we want them to have at least a partition between them. The fire marshal currently has guidance, though, that with indoor activities, any indoor activity can't be more than 25% of normal capacity. So, you can imagine a basketball game or something like that has to be limited to 25% of capacity. But certainly, these play groups and these static groups, we would want to, if they were indoors, say a gymnasium, we would want them to be separated by a partition.
Thank you. The next one is dealing with as teachers, they'll be in the classrooms in the summertime and possibly, if there were situations where they were handing out papers to students, or students in turn turning papers in to the teachers, relative to those type of transmission of documents and papers, etc. How can they address that? And is that okay? Is there some practice during?
Yeah, that's where the frequent hand washing comes in. There are going to be something, in general, we don't recommend that people share cups, glasses, utensils, pens, school supplies, things like that. Again, that's where this criteria of if somebody is ill, we don't want them to come. But you do all of these things, you stay 6 feet apart. This is where the hand washing really comes in. I would certainly have, just put in some simple rules that, everybody turns in their assignment all at the same time. And the thing you do right before you turn in the assignment is use hand sanitizer. You turn the assignment in, that way your hands were clean when you touched the paper, when you turned it in. So again, we're trying to make some reasonable accommodations to allow this work to continue while trying to minimize the effective transmission.
Yeah. What would you have for recommended opportunities relative to have a break from wearing the mask per se? There's questions about, if we have an 8 to 9 hour school day, is the expectation that mask be on the whole time?
Well, so remember what the mask is doing. Again, the mask is preventing you from spreading coronavirus if you are asymptomatic. So certainly for a teacher or an aide or someone like that, if you needed a break, I would just step away from other people. If you are alone or outside or a place where you are not within 6 foot distance of other people, then you could take a break from it. I certainly wouldn't recommend it as a habit, though. If you are going to have unexpected encounters, say with students or children, I would do my best to keep the mask on. I myself, working in hospitals, those first few times of wearing the mask, it is uncomfortable and it's difficult, but you do get used to it very, very soon.
The 6 feet social distancing, can you speak to how that relates to a static group of 10 that may be in a classroom?
Yeah, so in a classroom, certainly with older children, I think pretty much everyone on the call is gonna, if they could see my face if it's a bunch of 5-year-olds, trying to tell them that it's 6 foot distance. As Hannah mentioned, that's the group, that's why we have the group size limitation, because we understand that children do not understand physical distancing and probably are not going to be able to. That's why we want them to stick with their solid group of 10, their static group of 10, and not move beyond that, because we recognize that physical distancing with children, especially small children, is not possible. However, as children get older, and if there is the opportunity for them to understand physical distancing, say you're doing art projects in a classroom type setting, you stick with your group of 10, but I would put the students 6 feet apart if you could. And I think, Ken, you asked me about the rationale for that. When someone coughs or sneezes, these water droplets tend not to travel more than 6 feet. So if people are 6 feet away from each other, it is very difficult to get coronavirus.
Thank you. We've had we had a few questions come in about, we know that on the front end, when you get a diagnosis, a positive diagnosis of COVID-19, that there's the 14-day quarantine period. Can you speak a little bit about the current guidance as it relates to returning, about, requiring negative tests upon returning? What is the guidance as it relates to returning once you've had a positive test?
Sure. And I myself sometimes have trouble with this. So if someone is diagnosed with coronavirus, they are going to be isolated. And excuse me, what that means is we have a positive test. We're going to tell that person, stay away from other people. But believe it or not, that person, and as long as they're well and they can manage the disease at home, what's going to happen is they may have fevers, they may not feel well, but the sort of general rule is that person has to wait at least 3 days after their fever goes away without the use of fever-reducing medications to return to activity. After that 3 days, they're probably not contagious anymore. The other option is for someone who just got a coronavirus test and they're not sick at all. They need to wait 10 days from the point of that test in order to return back into their normal activities. Again, by waiting 10 days after your coronavirus test, or at least 3 days after your last fever without the use of fever-reducing medicines, then you can return to school or work.
Thank you. The next two questions I'm going to package together for you, and they're very, very medical oriented, very technical. One is, can you get the coronavirus more than one time? And then also, what consideration should be given for the eyes? Apparently, there are some reports out about coronavirus relative to getting it in your eyes.
Yeah. So the answer to the first one is, unfortunately, we don't know. Several people in China, and there's experiences in China where someone had coronavirus, and then at some later point, say 2 or 3 weeks later, they didn't feel well, and they got another test, and that test was positive. So we don't actually know, though. Coronavirus isn't, or viruses in general, just for everyone's knowledge, are not actually living. They're just little pieces of genetic material that find a way to get into you and then use your body to be a factory to make more of them. And what can happen, though, is these little pieces can float around your body even after you're well. And if we do a test for it, we don't actually know whether that virus is still alive and able to spread, or just left over from when you were infected several weeks ago. So what they're thinking is that the safest protective measure is to have people wait and do this recovery period after they were sick, to see if to use this as a standard for going back to work. As to whether they can get sick again, we do not know. I hope not. We don't have that information. And then the second one about getting coronavirus in your eye, remember your eyes are wet. I'm going to, give everyone kind of a gross example, but if you were sitting at the dinner table and someone next to you had coronavirus and they sneezed, everyone, without covering their mouth, you can imagine how many of those wet droplets would come out of their mouth. If your eyes were open and you were sitting across from that person, that would be a mechanism by which coronavirus could get into you. I certainly would suggest that it's a much less common mechanism than, say, for example, if you shook hands with someone with coronavirus and then rubbed it in your eye. That would be a much more logical way to get it. Certainly your hand on these frequently touched surfaces, if we didn't clean them, or if you shook hands or cared for someone with coronavirus, did not wash your hands, and then touched your nose, mouth, or your eyes, that would be a really effective way to get coronavirus.
Great. I think I can get us down to 3 more real quick questions here, Dr. Welch. Can you speak to the static groups and those groups rotating, for instance, either out of a classroom and then the next static group coming in. And the same would be said of a bathroom facility. If a static group, they had bathroom times, and then when the first group of 10 were to exit the bathroom, in both of those situations where static groups are rotating out, what would the cleaning protocol be for that currently?
I would definitely recommend frequently touched surfaces be cleaned. And the way a lot of facilities are doing this, if the person who is supervising the group, or even if the children are old enough to understand what they're doing, certainly having older children clean the surfaces. We're about to exit the classroom. We're going to go out to the playroom. Everyone take, a cleaning wipe, whatever it is, clean your desk and your chair. And then as you exit the building, clean the door handle and the desk and anything you touched. And then on the way out, have one person open the door and everybody throw their wipe in the trash can. That way the group coming in will know that the area has just been cleaned. That's kind of the way I would solve that one. If it's very young children, what I would do is I would, open the door, I would have the children exit with their supervisor, and then I would have the frequently touched surfaces cleaned before the next group comes in.
Thank you. Can you clarify about wearing the masks when it's required? Would it currently be through phase 1, or would it be through phase 1 and phase 2?
Now, again, I'm gonna clarify that one a little bit. So far, all we know that the governor's order is during phase 1. So during phase 1, I know a mask is going to be required. What he will decide for phase 2, I do not know.
2 more questions.
Sure.
For school systems that are considering having some type of graduation ceremony outside, how, like on a football field, for example, how would that relate to having static groups of 10, whereas, the student body may be sitting together, the seniors,
yeah.
The social distancing for parents that may be in the background?
So I just was on a call with the state health officer, and he's really not recommending that. And the reason is because you really do want, for any, you want to maintain a 6-foot distance between absolutely everyone, and then crowd capacity for any large venue needs to be less than 25%. And unless you could be assured that people at a graduation would not interact with each other in a way that they were touching each other, which is, kind of the antithesis of what graduation is all about. So I think the state health officer at this point is recommending virtual graduations.
Thank you.
Or I'm sorry, if I could just clarify that there's lots of other virtual graduations. There have been drive-through graduations. Different mechanisms of doing that while making sure that you could maintain social distancing with a crowd.
Right. The next one is just more of a clarification for those on the call. We're getting some questions about, number 1, pool usage and swimming teams. Number 2, marching bands. Is that considered a contact sport? And number 3, the administration of the ACT in June. And I would just say to those on the call that the department is working with the Office of Public Health, and Dr. Welch is working with us, and we will have additional, more detailed guidance coming out around summer athletics, which will address the marching band in swimming. And then also we will have very soon coming out that we're going to be discussing later this afternoon, Dr. Welch, that guidance around the ACT exam administration in Zoom in schools. So we'll address those. We'll address those in our further detailed guidance, which is forthcoming. And so I'll just close on this last question, and that kind of leads into this slide, Dr. Welch, as we're caught up on our questions, and that is, for school systems that have some of these really detailed questions, what role does their local public health office play within their region? Are some of these questions things that they can reach out to their local public health office and get answers to?
Absolutely. Have your school principal or your school superintendent or school nurse, whoever the appropriate one to ask the question, reach out to your regional medical director. And those regional medical directors, you can find those on the LDH website under Office of Public Health Regions.
Thank you.
Thank you. Ken, anything else? I have a couple of final comments if you have nothing else.
I think we've really worked through the vast majority of them, Hannah, so I think we can proceed. Others can, we'll post these slides, this recording, so it'll be able to go back and people will be able to watch it. And so, yeah.
Great. Thank you so much. I just want to offer my very deep and heartfelt thanks, Dr. Welch, to you for giving us so much of your time and expertise. As you mentioned at the beginning of your remarks, this is a complex time, and there are competing values in play here. The need to serve children, particularly for children of parents who must return to work because they're essential workers or because they need to earn a living, and the need to ensure that we have healthy and safe environments, as safe as possible in this time. And your very close guidance and your close work with us has been just invaluable. Thank you, and thank you for spending so much time with us today. If we turn to the next slide, I want to just reiterate some next steps that we have. So moderator, if you could just advance to the next slide. As Ken mentioned earlier, we will have guidance forthcoming around athletics and transportation. We hope that will be available in the next 2 weeks' time. That will work through, again, the Office of Public Health will be guiding us along the way in developing that, and then it will work through the Resilient Louisiana Commission structure, and we'll make that available to you through our regular channels, the Thursday morning calls with school system leaders, the newsletter, and the COVID-19 website on Louisiana Believes. Again, if you have detailed questions that you on which you need public health consultation, as Dr. Welch mentioned, please contact your regional public health officer. We'll make sure to include a link to that in our next communication to you all. And please feel free to reach out to us at the department with any further questions you might have at this LDOE COVID-19 support address. Thank you so much for joining us today, and have a great weekend. Take care.